silent epidemic that affects more than 40% of women, and it's a condition most often associated with men. We're talking about hair loss. Joining us live this morning in our studio to tell us more, we have Dr. Nicole Rogers from Hair Restoration of the South to tell us why we're losing hair and what can be done about it. Good morning to you.
Good morning.
Thanks for coming in.
Thank you.
And August is Hair Loss Awareness Month. Let's start there.
Yes, so this is an exciting time for us to increase awareness. Obviously, the most common cause of hair thinning and hair loss is actually genetic.
Yeah.
You know, there are lots of misconceptions. People think it's due to wearing ball caps or not washing the scalp enough, but actually male and female pattern hair thinning are the most common causes.
All right, and for women, because we're focusing on women in this segment, 40% of women around age 40 experience hair loss. Is it because of genetics, one thing, and, you know, all the things we do to our hair?
Well, it always depends on the amount of time they've been having the hair thinning for. So if it's less than 6 months, we look at temporary causes of hair loss.
I see.
These could be crash dieting, having a baby, having a high fever, or a prolonged illness. But if the hair thinning has been going on for more than 6 months or closer to a year or 2 years, and especially if they have a family history, then we think about actual genetic causes.
What are some of the treatments?
So the only FDA approved medication that we have for thinning in women is topical minoxidil.
And there's also a laser comb you can use.
Exactly, and this is something that has been around since 2007 when it was FDA approved for men, and in 2011 it was also FDA approved for women, and we're seeing more and more good data showing a statistically significant increase in the number of hair counts in the treated areas with these devices.
And how long does it take it to work? When will you start seeing improvements, your hair growing back?
Right, so it's the same as any other medical therapy. It generally takes 3 to 6 months to start to see results.